Welcome into To Your Health. February is National Healthy Heart Month. And today we have a very special guest. In fact, during the course of February, over the next 4 weeks, we're going to do a whole series on the heart. And our special guest is Dr. Elizabeth Jackson, and she's a cardiologist and also a medicine professor at UAB in Birmingham. And she's part of the American Heart Association team that's in Birmingham. Well, Dr. Jackson, when we were talking on the opening here, we were talking about the fact that during this whole month of March, we're going to be looking at this wonderful thing in our body called the heart and things we can do to find out if there's problems. And we thought we'd start off because most of my audience are people that are a little bit older. You can see some external things happening on you, maybe a wrinkle or two, or maybe some of this turning a little bit gray, but it's hard to realize, how does our heart really age?
It's a great question. And I'm going to answer that in a little bit of a holistic way, because our heart is clearly essential for everything we do, pumps blood everywhere, including the brain. It is how we get around, how we do what we want to do, but it doesn't work in isolation. So the heart is a system, a circulatory system, but also it really gets input from other aspects of our body. So our brain telling us that we need to move faster, or we need to get here or there, or we get frightened and our heart is going to increase the blood flow appropriately or decrease it appropriately. So I like to think about when we're thinking about the heart, we're thinking about aging and how the heart ages. I would shift that a tiny bit to think about healthy, holistic aging. And, a lot of that is going to be in two buckets. First bucket is knowing those risk factors. We've known for decades now, starting even before the Framingham Heart Study, but that was a landmark study, to look at traditional risk factors. So blood pressure, cholesterol or blood lipids, blood glucose, also if it's high, you can have diabetes, smoking, all right? And then, thinking now, the AHA is thinking about Life Essential 8. We also think about things like healthy weight and sleep. So, kind of makes sense. I mean, heart health is a little bit, common sense things. And if we think about knowing our risk factors, anybody can do this. We can get on the website at American Heart Association and learn about Life Essential 8, but we can also work with our healthcare provider or clinicians to understand some of the metrics that might be based on labs. So knowing your blood pressure, even potentially measuring
doesn't your blood pressure increase as you age also?
Well,
Normally?
yes and no. So
No, okay.
unfortunately, in the US, a lot of times the way we live, what we eat, how we exercise, or maybe how we don't exercise, can really affect our lifelong risk of hypertension. So hypertension or elevated blood pressure is very, very, very common in the US. However, you can have people who are in their 60s, 70s, 80s who have normal blood pressure. And generally, they've been thinking about diet and exercise. And I don't mean diet like absolutely losing weight, although a healthy weight is important. Talking about healthy foods and vegetables, fruits and vegetables, healthy grains, lean meats. A healthy diet along with regular physical activity can go a long ways to helping you prevent hypertension. Now, as we get older, our blood vessels can get a little more stiff, and then they do not open and contract quite as vigorously as they might have when we were in our 20s. And that can contribute to, elevated or higher blood pressure, but it doesn't mean that there isn't a lot that we can all do to try to keep our blood pressure at a nice, healthy range. So great question.
Yeah, it is. So again, the heart, they say, is about the size of your fist. And and it's working constantly. Doesn't
It
take a break.
It does not stop.
Yeah.
It's well, I'm a cardiologist, so I'm biased. I think it is the
Yeah.
most important organ, but again, it doesn't function in isolation. So
Hmm.
it does never stops. It keeps working. And if we treat it right, it keeps working for longer and longer periods of time, and it does the things that we want it to do.
Well, thank you so much. This is some good information. I'm going to have you come back next week, and we're going to talk about some things that can happen that you really need to pay attention to because it may let you know that your heart is having a problem, or basically you're having the problem.